Welcome to Elevate with Erica, conversations around wellness, where we explore many ways we can support healing, well-being, and quality of life. Recently, I was honored to be joined by someone whose dedication to compassionate care is truly inspiring, Mary Paolone. Mary is the clinical nurse counselor for the MDA ALS Center of Hope and the ALS Hope Foundation, as well as the program coordinator for the Temple Health Neurodegenerative Disease Center. Since 2005, she has been a guiding light for individuals and families navigating ALS, bringing both her medical expertise and her background in counseling psychology and psychological trauma. She describes her work as an honor, and I can absolutely relate to that. Working with clients who have ALS has been one of the most rewarding aspects of my career as a massage therapist. The power of human connection, touch, and intentional care is profound. And I've seen firsthand how massage can bring comfort and relief to those living with neurodegenerative diseases. I was grateful for the opportunity to sit down with Mary and dive into the ways we can better support individuals and families facing ALS. And here's our chat. Thank you so much for being here with me today, Mary.
Well, thank you, Erica. It is truly an honor to be here. Yes, and thank you for all you do as well.
I'm super excited to educate not just massage therapists, but also caregivers and patients today with this information. So let's get started. Can you give us a brief overview of ALS and how it affects the nervous system and the muscles?
Absolutely. So ALS is the formal name for ALS is amyotrophic lateral sclerosis. And it is what we call a neurodegenerative disease. Okay. So it's interesting because ALS actually looks like a disease of the muscles because the muscles are progressively getting weak. Yet it is a disease of the motor neurons. Okay. So I won't get too technical, but just so people understand that the motor neurons are part of the nervous system in the body that virtually send messages to our muscles and tell them what to do, right? When they're supposed to move, relax, things like that. So what's happening is that the motor neurons, for reasons that we're not fully aware of yet, scientifically, but the motor neurons are dying off. So then these messages don't get sent out to the muscles. And if the muscles are not used, they start to get small. So we call that atrophy, right? So they get smaller in size and they progressively get weaker as they lose signals and kind of the, messages to the muscles. So ALS then is a progressive and degenerative weakening of the muscles throughout the body. And I have to say, average lifespan statistically is from symptom onset is about 2 to 5 years. So it's rapidly progressing for most people. And the diaphragm, of course, is the muscle, respiratory muscle that helps our lungs to inhale and exhale. And it is also one of the muscles that eventually get affected with ALS. So ALS actually is, can manifest in kind of 3 different ways. The most common manifestation is what we call limb onset, where it presents in somebody's limbs, where they might have weakness in the hands, or they might have weakness in the ankle, or they might start tripping, or there's something that we call foot drop, where there's weakness in their ankle and foot, and then it progressively moves through their limbs. Okay, then and that's somewhere around 80% of people, and then there's a smaller percentage of people with this disease that present in, say, speech and swallow. And we call that the bulbar region of the body. And they might start having slurred speech. People might think that they've been drinking too much or something, and they get sent to all sorts of different doctors, ENTs and things like that. And, that is a smaller percentage. And then there's even a smaller percentage that is pretty hard to diagnose, but that's a kind of a respiratory onset where they're physically strong, they're talking fine, yet they get incredibly winded more easily. And this happens kind of progressively, just like all the other symptoms. And again, most people with ALS are sent to a number of various physicians before they even get to a neurologist for some of them. And so the time to diagnosis can be, up to 18 months, sometimes even
Wow.
longer. Mm-hmm. And if you think of the, total lifespan that we're looking at, um, I appreciate when people such as you are doing things like this so we can help people understand and, increase awareness and potential earlier diagnosis and things like that. So it looks like a
Sure.
disease of the muscles, and it's actually the motor neurons that are feeding the muscles and telling the muscles what to do that are dying off for some reason.
Yeah. And like you said, you have that time where other people are looking at it, not sure what they're looking at, and misdiagnosing. I do have a client who was late to be diagnosed because she was misdiagnosed. Um, it's a sneaky, sneaky disease.
It is a sneaky disease, yes. Mhm.
Yeah.
Mhm.
What would you say are the biggest challenges that caregivers face when supporting somebody with ALS?
Well, that's a big question. We could have a full hour on just that. um, mm, yeah, so we feel very strongly. I feel very strongly, right, that the ALS does not occur in a bubble. That the caregiver, so I have the benefit of, being in the clinic with the families, and also being, going to their homes and seeing them. So kind of making that bridge between. So one of the things that we always tell our caregivers that they are as important as the person living with the disease with ALS. Um, because they most likely will become uh, the all of the dependency, or much of the dependency that the person living with the disease will be placed onto then that caregiver, right? So, probably a quick way to say it is that, they're going along living a life with visions and dreams, and this is for the person living with the disease as well. And then all of a sudden they're totally uprooted, put into a new, completely unfamiliar world and life, um, with, in a sense, no preparation, where they have to speak a new language, which is the medical world, healthcare system, all sorts of that things. And also then trying to manage symptoms and a disease and needs that are continually firing and changing, and being able to be, I had one spouse that I'll never forget how he described his life. He said, I am perpetually prepared for everything that happened last month, right? So the sense of kind of always being behind the eight ball, right?
Yeah.
And it's tiring. And the other thing I really want to stress, and this is certainly for caregivers, and this is also for those that are living with it. Not everyone, but certainly a large part. Having done this work for a good amount of years, and having worked with a lot of families, you know what what often can happen to their nervous system is that they receive this information of diagnosis, and then very quickly can become overwhelmed. The nervous system can become overwhelmed and can activate the sympathetic nervous system, fight or flight, right? Fight, flight, or freeze.
Mhm.
And there can be this sense of, living in that almost a hypervigilance. So there's a lot that's happening, for the person living with the disease and also the caregiver. Like I said, we could go on and on. So yeah, so there's a lot. It's really It's really something. It is extraordinary, extraordinary.
Yeah. And I've dealt with, uh, you know, uh, caregivers that are hired, you know, but also spousal caregivers. And you and I share um, a client of mine that I very dear to my heart, these people. But part of me going in and working with my client who has ALS is offering a little bit of respite to the caregiver. And I totally agree with the fight or flight thing. It's You cannot be in fight or flight all the time. You can't, it's not good for you. And that is, if I can just give 1 hour of rest and digest to two people, I get to do it to two people when I'm there, and that's the kind of stuff that I want to pass on to other massage therapists out there who are thinking about making a change. It doesn't have to be a deep pressure game. There are groups of people out there who truly need this work. And I just want to, shed a light on it for everybody. Um,
I
so
love that. Yes. I mean, and it is so needed. And that's the thing. I mean, I was sharing with you that, it very often, there are myths out there about massage and all sorts of things, right? Especially in the
Absolutely.
world of ALS and lots of other diseases. And, with I'll get many messages from our either people living with ALS or their loved ones. Can so and so get a massage? Will that hurt them? And just like you said, you know, even if it's for the, space and time to just activate the parasympathetic nervous systems, to just have a little bit of, physical connection and touch as well, which is so lost. And then to be able to give that loved one, a little bit of a breather space is just, they're really like, they're the small miracles that we want
It,
to infuse more and more.
it's super rewarding work. There's definitely an energy exchange. And it's just it's a
Thank you.
rewarding job for sure, for sure. So when we're talking about caring for a client with ALS from a massage therapy standpoint, what role do mobility and just like positioning and bolstering, what role does that take on when we're talking with somebody who has ALS?
So yeah, that's a great question. I, of course, am not a massage therapist. So I will leave a lot of the collaboration to you and the person living with the disease, of course. However, there are things to be aware of. I think the biggest thing is that even though one of the myths out there, or one of the terms that I've heard used often, is, kind of this fragility, that people are fragile. They're not. They're not fragile. They are. So if we have a conversation even in the hospital, when I go and see our folks in the hospital, I have other nurses, because I'm a nurse, and I have other nurses that are, just scared to go near them, right? If they have a breathing mask on, or if they, can't use their hand, they're just scared in some way. And it's just from just not knowing, right? And I remember that. I was too when I first started, right? And guess what? The greatest thing was, even today, 20 years later, I just ask people, you know, how would you like me to move your arm? Right? Is it okay if I move your arm? Right? Do you want some help? Right? Just simple questions that I think as a human, especially like sometimes I can walk in and just forget, right? Or just make an assumption, right? So is there a delicate hand that's needed at times? Absolutely. But are people fragile? No, right? And what many people have told to me is, or said to me, is that, they want to be, met with the same, like, I'm still Joe, I'm still Sally,
That's totally
um,
right.
yeah. And in that, the other pieces that are important, as the disease progresses, more immobility occurs, right? People can have spasticity. People can have frozen shoulders. They can have something that we discussed is they can have tremendous neck weakness where they can't hold their head up, right? And their breathing can also become more involved, right? They can have breathing difficulties. They can have swallowing difficulties. So for someone that is, a potential massage therapist that isn't familiar with these things, that can be scary, 100%. So, positioning is important, right? Let gravity help us, positioning just in the sense of having people elevated. Like these are just some kind of general overriding things for ALS to know about ALS. Try as much as possible not to lay people on their back, which is a common position for a massage, right? Flat on the back, people can have difficulty breathing. They can have difficulty with secretions. They can have, or swallowing, right? So having the head of the head elevated a bit can be really helpful, right? If somebody has neck weakness, if somebody has neck weakness, being able to prop the neck in a way where they feel like they can swallow appropriately and it's not too uncomfortable, where you guys as the therapist can still get to the places that you need to get to, right? The other thing too is that, and this can happen at any various times. I just know from my own massages that I've gotten myself, right? When I'm, and also as a nurse that works with people with ALS, when I'm in there attending to someone, or with someone and I'm attending to them physically, being aware that even though I might be attending to their head or, their upper body, that because they don't have strength or the ability to control their arms or their legs, their arm might flop off the side of their, might fall off their lap or might fall off the side of the table. And just being kind of aware of the bigger picture so we can, address that and really make it comfortable for them. So, so oftentimes when I'm with people, I'll kind of take a view of the whole body. If I have to work with somebody's feeding tube or their trach or something, or breathing tube, I'm sorry, I will kind of get a sense of the whole body, where everything is, and just ask them, are you comfortable in this position? Do you want your arm moved? Whatever it may be, just so they can be there for a while.
Yeah, absolutely. I think that was a great answer. I have learned through trial and error. And I mean, it's horrible to say, but it's true. And my clients would wholeheartedly agree with me. But yeah, I mean, working around the CPAP, the breathing machine, working around maybe a feeding tube, working around a cath, tube, is all new stuff to me, but not difficult to learn. It's not difficult to learn. And once you do it once, it's done, and I can do it for anybody now. Like now I totally get it. I understand those tubes and they're not scary and I can touch them, I can, it's okay. Like nothing's going to fall out. Nothing, it's going to be fine.
No, I know, but these are, it can be really fun.
Listen, if you've never dealt with it before, it can be a little overwhelming.
Right. Even in the sense of when I first address people, and I have to tell, it's like even people that have come this past year, we've had a lot of new members join our team, like our clinic multidisciplinary team. And even in the sense of, even if the person's been a healthcare provider for 30 some years, when we first walk into a room, just as a human being, for a lot of us, the common greeting is to go and shake somebody's hand. And somebody with ALS potentially can't do that.
Right.
So how do I greet this person? Right. So sometimes I'll just put my hand, if it's okay with them, on their knee and say, it's so nice to see you. Welcome back. Right. So they don't feel like they can't reach out to shake your hand. Right. It's all these nuances that just as healthcare providers just make us more and more aware of these, kind of the delicacies.
Yep. For my one client, our shared client, my greeting is always a squeeze of the toes and a hey bud,
nice.
Little squeeze, hey bud, and I get myself all settled in. But yeah, for another one, it would be totally different because, and every client has their own nuances.
Yeah.
So you just learn them. But it's just such a, it's a lovely way to just bring peace to somebody's life. So, and I really hope that, talking about it more will open the door to other people walking through and helping us out. So let's talk about common misconceptions of ALS. What can you tell me about like some of the most common misconceptions?
So about the disease itself or about
Yeah.
ALS and massage? Okay. So the
Yeah,
disease
the
itself,
disease itself and like what the patients are going through. What would be some misconceptions there?
that it's contagious. It's probably number one.
That's a really good misconception. Good, yes.
It is not contagious, to the best of our knowledge.
Yep.
Um, so there can be a genetic component in a small percentage of the population. About 10 to 15% of the population of people with ALS can have a familial, right, a hereditary kind of genetic uh, composition to it. But it's not contagious, like another, flu or something like that. So if we touch people, if we're around people with ALS, it's okay. Yeah. And some other misconceptions that, I think we already talked about another one, that they're fragile, right?
Right.
Some ways, right? Even though there's a heightened awareness that is called for and a kind of delicacy in some ways, they they're still
Yeah.
their old selves.
And my clients do receive pressure. I don't want to be
That's great.
leading people to believe that I'm giving them a light touch massage. My clients, their muscles are met with pressure. And we have our way of communicating with each other about pressure. But you can feel their muscles. It's not like they are completely slack. Old adhesions, they still exist in their body and they can still feel them. So, and if you think about the body like atrophying like that, it would be so uncomfortable and like painful, and to have it be met with a nurturing touch, it makes a difference. And you talked earlier about like medical touch. A lot of these clients are used to being poked and prodded by the medical community. So to have a massage therapist come in there and only touch them with a nurturing hand is such a relief for them, I think. I really do.
Yeah, and I am a big proponent of that, just in the sense that, any ways that kindness can be infused more into their lives and kind of softness, because so much of living with the disease, both for the person and the caregiver, seems, brutal at times and like a battlefield. That any moments of softness, kindness, kind attention, the more that we can increase those, the better.
Yeah,
And
it does
massage
make
is
a
definitely one of
difference.
them.
And the beauty of me coming to people's homes to work is my clients get to set their own scene. So if they want to listen to disco music, if they want to listen to classic rock, whatever they want to listen to during their session is what we listen to.
Mm.
I have some people that are very particular with their music.
We did have one guy that had massages often towards the end of his life, and I would walk in for a home visit, and the whole house was Pearl Jam.
Love it.
It was awesome.
Yes, I
Yes.
love
And then
it.
I have another woman where it was, you would think that you were walking into a spa when her massage
Yep.
therapist was there, which was so, and both were so, that was invigorating for him. And it was a time, he used to describe it to me, that was a time where he could forget that he had the disease, because you're not supposed to move during a massage necessarily. It
Right.
is because during that time, it's okay for someone else to move your body.
I
And
didn't
they
think
could
about that.
forget that they had ALS. And that is such a gift.
I never thought of it that way. I love that.
Well, yes. So
That's
thank you
wonderful.
for
Yeah,
that.
I love
Mhm.
it. What kind of specialists makes up like a typical ALS care team?
Okay. So, yes, it has become a standard of care across the nation and in many parts of the world, thank goodness, that a multidisciplinary approach to ALS care is, yeah, is the best. And that includes, like, I mean, our team with the ALSO Foundation at Temple Health is um, consists of the physician, the neurologist, of course, it's a teaching hospital, so we have lots of residents and medical students as well. Whole entourage there, if people are okay with it. So there's the physicians, of course, myself, the nurse. So I play two roles. I'm the nurse for the clinic, the coordinator, and I'm also the mental health nurse, right? So, that I try to separate it sometimes, but it's, absolutely a huge piece of what we believe in. Not all teams have mental health specialists on their teams because funding is a huge issue for these centers to be able to provide this type of care for people. So there's the neurologist, the nurse, we have a social worker, respiratory therapist, or pulmonologist, um, a dietitian, speech pathologist, physical therapist, occupational therapist, and then we have our research counterparts who do clinical trials and other, basic research and things like that. So it is a pretty full team. Yeah, and there's a lot just because the disease itself, touches so many areas of the body and areas of life that we do try to provide kind of one-stop shopping. Um, and all of the people that they see at this center in particular are specialized in ALS. It's not like, your physical therapist is going to change every time you come back to clinic. It's the same people that have worked in the field for a number of years and have expertise within it.
That's wonderful. And I'm very lucky to have you guys close to home.
Oh, yeah.
I'm so lucky to have such a font of information. But where, massage therapists all over the country and all over the world, where could they start? Who could they reach out to? How could they best collaborate with a team like yours?
So I am a huge proponent of that. And I say to all of our families that, if you're working with a massage therapist or any discipline that or a person that's coming into your house, we are 100% more than willing and want to collaborate on people's behalf to educate people, to help them understand the disease process, whether it's a psychologist that they're working with or a mental health person or a massage therapist or a physical therapist that's coming into the home, anyone. So they can, certainly they can reach out to the Hope Foundation, the ALS Hope Foundation. We are more than willing, to help people understand, educate, collaborate, all of those things. The other piece that's a really great resource is youralsguide.com.
Hmm.
So the youralsguide.com is a wonderful, comprehensive educational resource for people living with the disease, family members, friends, caregivers, professional caregivers as well. There's
Okay,
a whole section on professional caregiving, not specifically massage therapy, but it does talk about massage therapy. So it is a wonderful resource as well.
great.
Yeah.
Yeah, that's wonderful. Um, so I know that clinical studies are very slow to get going and also conclude. But is there anything coming down the pike that you're excited about as far as advancements?
Well, I will say a few things. Probably the first thing. So I have had the truly deep honor of working within the space of ALS for 20 years. So I have seen, and I know, I work with people that have been in the environment for even longer than that, right? For a lot longer than that, actually. So we've seen things change, which is incredibly exciting. everyone in the world of ALS knows that, and those that are living with the disease, people that have the disease and also their loved ones, they know firsthand how incredibly, like you described it, molasses in winter, how slow it can
So
feel like it's
slow.
moving, right? So when I look at the 20 years, I would say over the last 8 or 10 has been incredibly, like, a huge uptake in movement, in research, interest, advocacy, awareness, you know, new substances and, molecules coming down the pike and things in the pipeline, stuff like that. So for me as a clinician looking at the bigger picture, it is an exciting time, right? I realize that a lot of things are changing with funding, these days, and that, there's an uncertainty in terms of what things will look like. But separate from that, what I often tell our families is that we really are in a new ballpark. I could say and I never hold the idea that I or we as a medical community or scientific community know everything. But statistically, what we had seen, I could say to families 10 years ago pretty surely that, even 8 years ago pretty surely that, average lifespan that we know of, if somebody was really asking me, and I could tell them the answer to that question. Now, what's exciting for me to be able to say is that, we are in a new ballpark. I don't fully know, right? There used to be one medication out there. Now there's two, right, that are FDA approved, both to slow the disease. And so with the combination of those two, who knows, so that's exciting, right? That they both, have shown that they can slow the progression for people. And, with that combined with the increased uptake in research and interest and awareness and advocacy around trying to find a treatment, those things excite me. Right?
Yeah.
Yeah. And are hopeful. We're the ALS Center of Hope. So
that's right.
I'm always looking for the hope.
That's right. Well, I'm very thankful for you and your team. It's been a real joy to get to understand this disease over the past couple of years. Obviously,
Thank you for saying that.
There's a lot of sorrow involved. Don't get me wrong. It's a heavy thing. But I think that if massage therapists can be honest with themselves about the situation, obviously. We all have to be honest with ourselves about the situation at hand. At the same time, every moment that you are present with these clients and their caregivers is so rewarding. And being able to come into my clients' houses, I have no idea what I'm walking into on a daily basis.
It takes courage. I thank you for that.
It could be a good day. It could be a bad day. We don't know.
Yes,
but
100%.
I found that facing it with humor is very important. And hugs heal. I do know that. Hugs heal.
Yes, hugs and smiles and gentle touch.
God. That's right. Yeah. And I want other massage therapists to know that. I hear them. I see it on Reddit. I hear them on videos. They're getting burnt out. They hate the deep pressure game. They hate the spa game, all these things. And I have gone independent. I've been independent for my whole career. But you can get out there. You can make a difference in people's lives. You don't have to burn out your hands, your wrists, your thumbs doing that. There's population out there that need this work. And I just hope that we can shine a light on it. And, get more people involved.
Yes, I definitely want to echo that, and thank you for that as well. It is courageous work that you're doing, incredibly courageous. And I think it is important for your viewers or whomever to know that we certainly, look forward to collaborating, with you to be able to provide educational resources for other massage therapists that are interested in this incredibly profound. This is the greatest work I've ever had the opportunity to do. And like you said, it is hard. It is not easy. And I'll tell you that I've never been, we get to be on the pulse of life, absolutely on the pulse of life, and really making a huge impact with people. So if there are massage therapists that are looking for impactful work,
Yeah.
we are here to help.
And I'm here to help them attune,
Wow.
protect their energy.
Yes, yes.
Learn to leave it, because it's a task. Like you do have to center yourself and be able to leave it at the end of, that too. You
That
can't
is
carry this around
another,
with you all day.
yes, right, which I think is an important, hugely important piece of any educational program for a care provider.
Yeah, absolutely. Yep. How to be in it in the moment and then sort of leave
Right.
it when it's done. So, thank you so much, Mary. I had a
Thank you.
great talk with you. I'm so happy that we were able to do this.
Same.
I do look forward to getting to know more of your team, because I think that we can do a lot of good, at least in our local area.
I agree, and I am so thrilled. Of course, I will go back to I can't wait to talk to our mutual client and yeah, and really, and bring you, have you at the foundation and bring you into clinic if you want to come. And yeah.
I would love to visit. I would love to see what you guys are doing and be able to give you a hug.
Yes, yes, wonderful. Great.
So thank you so much, Mary.
Thank you, Erica. Have a blessed day.
You too. Have a good one.
Okay, take care.
Bye.
Thank you for joining me for this very important conversation on Elevate with Erica, Conversations Around Wellness. I hope you found it as insightful and as inspiring as I did. The work being done at the ALS Hope Foundation and the MDA ALS Center of Hope is truly making a difference in the lives of individuals and families navigating ALS. If you'd like to learn more or find out ways to support their mission, you can check out the link in the show notes. As always, I appreciate you being here and taking the time to explore these meaningful conversations with me. Until next time, take care and be well.